Welcome to the October 2nd, 2023 Grafton Board of Health meeting. As a preliminary matter, this is Jennifer Maynard, Vice Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn?
Dan Finn, aye.
Austin Magnet?
Here.
Austin Magnet is present.
Thank you. Bill Mueller?
Bill Mueller here.
And Jennifer Maynard here. Staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Somebody's trying to connect to audio. Let's see, Amelia Houghton. That's probably her kind of trying to come back. Karina Scott. Oh, here we go.
Here I am. Thank you.
Welcome back, Karina Scott. Amelia Houghton.
I'm here. Can you hear me?
Can hear you. Ian Wong.
Present.
Thank you. Devin Thornton.
I'm here.
Thank you. And as I said, Nancy Connors will join us shortly. I would like to open the meeting. Can I get a motion to open the meeting?
Yep, this is Dan Finn. I'd like to make a motion to open this meeting.
Second.
This is Austin Magnet. I'll second the motion to open the meeting.
Okay.
Bill Mueller, I agree.
All in favor, roll call. Dan, go ahead.
Dan Finn, aye.
Austin Magnet, aye.
Bill Mueller, aye.
Maynard, aye. All right. Here we go. Here's the long part. Good evening. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency. This Act includes an extension until March 31st, 2025 of the remote meeting provisions of former Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open law meeting law. In order to mitigate the transmission of the COVID-19 virus, the Act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which can be found posted at the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded, so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There is no public hearing scheduled for this evening's meeting. If the public has a question or comment on an agenda item, please utilize the Q&A feature in Zoom. Please include your full name and address when submitting a comment. For this meeting, Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to screen share your computer. Anything you broadcast may be captured by the recording. Any supporting materials that have been provided to members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first agenda, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers on the agenda for a topic. After they conclude their remarks, I'll invite the board members to provide any comment, questions, or motions. Please identify yourself by name when speaking. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly in a way that helps generate accurate minutes. For any response, please wait until I yield the floor to you and state your name before speaking. If members wish to engage with other members, please do so through me, taking care to identify yourselves. Finally, any votes on any motions made during this meeting will be conducted by roll call vote. Okay, ready. All right, so I'm going to turn it over to the Alliance for the Alliance update.
Okay, that's me. Good evening, everyone. Just some quick updates on from the Data and Research and Epidemiology Office, which I was also a part of. So the CHOP process is in final stages. It will be slated for public release later this month. The priority areas that were identified during the process are 6. The built environment, which includes public transportation and access to culturally inclusive quality food, affordable and safe housing. 3, access to quality, reliable broadband internet. 4, navigating public systems, which include SNAP and Mass Health. 5, healthcare workforce shortage and reimbursement rates. And 6, culturally representative care and healthcare, which includes addressing language barriers. We also want to thank all the Grafton residents that participated in the public survey. It was a really great show of all the residents from our Alliance town. So thank you, Grafton. There's also where the Office of Epi and also several members of the community health team are in the process of planning the regional youth health survey, which will begin this month, and meeting with the superintendents to really get a clear view of how we're going to survey the students by the end of this calendar year. For that is my only update from that office. And also the other update I wanted to provide is I actually bumped into the chief of police for the city of Grafton at one of our outreach meetings. And so I was really happy to have a chat with him, invite him to the subcommittee for the opioid settlement funds. And he was very excited that we're getting together to talk about opioids and what's going on. So he would love to be part of a member once you guys have a set schedule or the first meeting set up. I also, in the name of the organization escapes me right now, I bumped into them to another organization, and they were actually curious to have a seat in the conversation, the subcommittee. They have funding available to deal with the rise of grandparents being main guardians due to the opioid pandemic. So they would also like to participate. They're also trying to they also have some funding available to invest in the community in Grafton. So I'll put this all in an email to Dr. Mueller as well, since you are the chair of that subcommittee. And that's my updates, I believe. And I think Devon will do an update on inspections, but I think that's it for me.
Any questions for Karina from the board members? Right, thank you. Oh, go ahead, Dr. Muller.
Yeah. I have a question about what the structure of the subcommittee is. You know, I know that I've been named the representative of the Board of Health, but I don't, you know, who owns the committee? I mean, is the committee, I mean, I haven't heard from anybody. I haven't really reached out for to anybody, but I don't, how is this going to be pulled together? Does anyone know that?
So I think that the hope is that as the chair, you can either decide when to have this meeting, whether it's going to be virtual or hybrid or in person. Once the first meeting is set up, I think everyone that has been invited or showed interest to be part of the subcommittee, which includes Mary Laurie, I believe that's her name, who is going to manage the financial aspect of the grant, who works for the city of Grafton, and who has a clear picture of how we can spend the money in the funds and how much we have in the purse. And then we have myself, Jennifer, for community health, and then we have the chief of police. I believe Jennifer was going to reach out to a Pastor John, who's also is interested in being part of these conversations and how we can support the residents of Grafton, especially dealing with opioids. And then in the conversation in the subcommittee, everyone can decide how best to spend the funds. So it's really just a subcommittee to gather together to talk about ideas that you guys want to do, whether you use data, we can help you with that. And really should be community-led decisions.
But we're referring to it as a subcommittee. It's a subcommittee of what? Of the Board of Health?
You know, it could be. I think I would just call it a committee, but I think everyone started calling it subcommittee, so I didn't want to step on anyone's toes. But it could just be a opioid settlement fund committee, where it's, you know, you as the Board of Health are representing them, but it could be named anything. I don't know if anyone had any clear idea why it's called subcommittee.
I think it's because we broke it out of this larger group, but I guess to Bill's point, are you calendaring that first meeting, or are you looking to him to kind of select that and you invite folks to it?
It could be either way. I'm hoping for some clear picture how you guys want us to help you. We can set it up, but I mean, you are the chair, so we want to make sure you're there. So you might want to give us 3 dates and we can send those out. And from that first meeting, everyone that's invited to that meeting can decide the frequency, what is the best time for everyone, and set that kind of like forth. But it's up to you. I don't want to, if you want me to take the reins, I can, but I'm hoping for some direction.
Yeah, I'd be happy to take an active role in it, but I think I need to have a better understanding of what the structure is going to be and what the process is.
Yeah.
Maybe we can talk offline about I mean, are you dealing with committees in other municipalities as well?
So different municipalities are deciding to do something different. Some are going to decide what to do. Some won't touch it and let it gather for several more years until it's a larger sum. We can have the conversation in the committee if you want to use it for regional purposes. So we can find other communities in the area that you can kind of team up together and fund certain things. I know West Boylston has received some funds, and Shrewsbury as well. So we could do it within the alliance. So yeah, and I believe also Worcester received funds as well. But everyone can decide to do something different, but I think it was from this group to do something more community-led, and that's why the committee was formed, or the idea came about.
And go ahead.
Yeah, this is Dan Finn. Yeah, I've expressed some interest to participate as well, and I think Jay Cummings from the school. So I think it might be best to pick a date and a time, see how many people we get to show up.
Yeah.
And the subcommittee piece, I think, is sort of due to the fact that we're going to need an administrative person such as Nancy to help get with an agenda and help set up a Zoom type of thing. And I think personally we have enough people interested that we ought to keep it Grafton for now, unless we can't get to an agreement after the first meeting, you know.
And this is Ian Wong. If I can say something, Dr. Muir, I think a lot of your questions will be answered as you start building the committee.
Yeah.
Right, seeing who's interested, and someone may say, "Oh, we should get so and so on board," and so, and that's how you can grow this community in the town of Grafton, be part of this group, you know. And then you can find different people, because there's young people going to be involved, older people be involved, the school's involved. You know, there's so many different aspects. And I think as you grow this, the questions you're asking will be answered.
Yes. So just a thought. So I think initially we want to do a subcommittee because we didn't really feel as though we should make that decision in just this group. We should, include other stakeholders, of course. So perhaps, Karina, if you could send sort of the summary to Bill and Dan, who it sounds like he might partner up on this. And then they can, send you some dates to schedule and invite the stakeholders you've already identified. And then from there, I think it would probably be helpful to sort of get an overview of, again, the funding and kind of what's available. And then that group may help to identify additional folks to bring to the table. And kind of, and as you said, kind of discuss meeting cadence and, how, what might be the best approach. But I think to Bill's point, we'll probably need a little guidance, from, as far as timeline and all those things. But if we could start, if that makes sense, Bill, in that.
Yeah, no, I think that's right. And I think we also need to get a sense of exactly what's available.
Yep.
And as I had said on a previous occasion, I think we also need to get a sense of what's already in place.
Right.
I don't think we want to duplicate things that are already being done. At the same time, I don't think it can be so large a committee as to be unwieldy.
Yep.
But I think Karina could at least send me some information about it. Maybe we can have some background discussion before we set a date for our kickoff extravaganza.
Dan, go ahead.
Yeah, and just a quick thing to that point, Bill. I happen to be in the big city, on Saturday evening at Polar Park and, Coney Island. But anyway, I'm not
Yeah.
making a advertisement for anybody. But I happen to see a couple of posters that UMass had put out, apparently, sort of a help, if you need any assistance with addiction or, or abuse or this or that, or any mental health issue, contact this number at UMass. It might be interesting just to find out if we can, maybe we're getting ahead of ourselves, but what that service is, just so we know.
Again, I think that's a question of making sure that we leverage other
Right.
existing, services as we move this forward, for
Yep.
sure.
Yeah.
There-
I'll be, sorry.
Sorry,
I'll be
Greg.
happy to send a summary and the purpose of the subcommittee and kind of like the three main ideas of what the outcome should be, what the subcommittee should be doing. And then I'll also list the names of and titles of folks that have showed interest, just so you guys can have a discussion. I've also met with Mary from the city of Grafton to get an idea of a quick overview of the funding, what's available, what will become available in the summer of 2024. So there's so I can put this all in an email and send it to you both, and you guys can have an offline conversation, and then give me a couple dates that we can kind of send it out to folks and form it together. Yeah, and then I think within the subcommittee, I think that can be a discussion where we discuss what is available currently for Grafton in terms of mental health and substance use, and to really understand an assessment of what you guys have, the resource assessment. What is the gaps? What are we doing well, and what are the gaps? And then that can give you guys a clear idea of where this money could go towards. So happy to do that.
Good
Okay.
discussion. All right. Devin, did you have other updates for the Alliance to share?
Yes, I do. Good evening, everyone. I'm Devon Thornton. I'm the health agent for the town of Grafton. Since the last meeting, I think it was September 12th, I've done 5 food establishment inspections. One was a complaint. I've also done 11 housing inspections. 6 of those 11 have been abated. I've been working with Donut Star. I think there was a question raised last meeting. They're up to code, and they're working with the Board of Health to stay in code, and I'll continue to monitor things and keep giving updates. That's today.
Thank you. I'm sorry I mispronounced your name.
Oh, no problem at all.
Quick question for you. Nancy did send along complaints that we received, housing related. Did those ones come from you?
Yes.
So just to follow up, there are 3 on there that didn't look like there were a status as of yet. 821, 97, and 98.
821 would be Providence Road, 311 be Providence Road.
Yep.
Right now, the tenant in that unit moved out as of October 1st. So the owner has been in contact with me and let me know that he'll give me a call when he's gone in and made all the repairs to the unit.
Okay. Go ahead.
No, I'm sorry.
Then there was a 97 McGill Drive.
McGill Drive. McGill Drive has been abated. I spoke to the owner on the it might have been, I forgot, I think the 15th.
Okay.
She'd taken care of it. Was storage units in the basement of the property. It was due to a humidifier that just stopped working as intended. She replaced the humidifier, cleaned all the mildew up, and also provided the tenants with whatever cleaning supplies they needed to wipe off their items in the basement.
Right, and then there were 2 for North Street, both 97 and 98 on the overgrown grass, the litter, garbage.
And that's been abated. The owner took care of everything.
Thank you. Sorry,
You're
ma'am,
welcome.
I just jumped right in there with that. But
No,
any
keep me on my toes.
any other questions? Inspection. Go ahead, Dan.
There we go. Yeah, just one thing on an item on our discussion, since we're talking, you mentioned the Donut Star. It just says 3-bay sink. What was the situation with a 3-bay sink?
The situation with the 3-bay sink was there was never a 3-bay sink in the restaurant. I went through previous inspections that had never been pointed out. So I've worked with the owner. She's building the funding to repair the sinks. She has a plumber that she's been talking to. I gave her 30 days to show me the estimate and also let me know how the sink's going to be put into the restaurant. But at this moment, since they only have small batches of things that they do wash, what they will be doing is utilizing the 2-bay sink. They also have a dishwasher that they utilize for plates and cups and utensils. So the one sink will be used to rinse and wash. Anytime they utilize the sink to sanitize, they will clean before and after sanitization. And if they need to rinse anything, which is the only vegetables that they have to rinse are just mushrooms and broccoli, they will clean the sinks first before rinsing any items.
Thanks.
But I will continue to monitor to make sure they keep up with the sanitization and everything until the new sink is installed.
And do they have to have a separate hand washing sink as well, or?
They have a hand washing sink.
Okay, great.
But the owner's intention is to bring the restaurant up to code.
Mhm.
So she plans on doing some renovations in the future as well.
Great. Very good. Thank you for that.
You're welcome.
Any other updates from the Alliance?
Yes, I have a few from nursing. This is Amelia. So just running down my list, in September, we had 21 documented COVID cases, reported, that is. We were not aware of any facility outbreaks. We had blood pressure clinics at the senior center, where Molly did 15 screenings in one day. She went to the Housing Authority on Maxwell Drive. No participants showed up. She went to the Housing Authority, Forest Lane. In September, had 1 participant. For that, we're still watching to see if the days or the times need to be moved around. But first, we want to give everybody a chance to understand the current schedule before we start changing things. We went to the health fair at the senior center. Beautiful health fair. We screened, I had two of my students with me. I have two BSN students that need community health hours, so I asked them to come. We actually screened 22 participants at the health fair, so that was pretty good for us. The topic of the month is RSV versus COVID versus flu. That was sent out, hopefully posted. We thought that was an important topic, especially with the new COVID and RSV vaccines. It's important to know that the symptoms can be similar for all three of those. Obviously, you know, I've been sending out the arbovirus update. Grafton along with Worcester, we're all at moderate risk at this point. And something going on for next month, just a heads up, it hasn't been posted yet. We're still finalizing it. We're having Shaw's Pharmacy come on October 20th to the senior center to provide adult flu vaccine. We're waiting right now to see if they can also add COVID. So in the next few days, I should have the answer to all of that. And Nancy will know, and Shannon will know, and that will be posted. Then on the 18th, from 2 to 5, we are doing the kids' flu. And we're still working out if the pharmacy can come in the morning to do the teachers on that same day. And then on the 28th, 9 to 12, half a day, just shingles shots for the seniors or whoever's eligible. And for that, we will be collecting the insurance information ahead of time. So that's up and coming. And I believe that's it, at least for the time being.
Gee, that's it? Kind of a lot going on. Sorry if you don't hear my stepson getting loud in the background. Okay. I think the Alliance gave us all their updates, and that covered a lot of our discussion points too, but I'll kind of click down the list just in case any folks have anything additional to add. Certainly, I know Nancy also posted as it relates to COVID, that there are testing kits are supposed to be available again through some government resources. So we did post that on the website, encourage members to share on their social media platforms as well. And of course, continue to follow CDC guidelines if you are exposed to or end up having COVID. But as Amelia said, could be any one of the three. Another one of those years. It's going to be pretty intense, it seems like. Members, anything to add on those topics? I think we covered the flu, shingles clinics. Do we have anything on state well regulations to discuss today?
I'm still gonna draft an email to Nancy to send to the water departments to get some information on their PFAS testing.
Great.
But otherwise, I don't think we really have anything else.
We talked about Donut Star. We talked about opioid settlement funds. The next thing is the proposed bylaw changes. I don't know, again, I don't think we have anything to talk through today. Oh, Nancy's texting. I can't hear you, Nancy. Let me see if I can unmute you. Unmute.
You hear me now?
I can. Yay,
Okay.
take it away.
So I did call the water districts and they are below the state limits. I said, well, if you do get a hit, what happens? They contact DEP. Both districts said the same thing. They would contact DEP. And that's right now, but I believe something is being worked on. I just don't know what.
Thank you.
And there was something else. Amelia, the clinics are going to be held in the gymnasium of the municipal center, correct?
Wherever you say.
Yes, the municipal center gymnasium.
We're gonna finalize all that this week.
Okay.
I hadn't heard from her because she was waiting last week to see if she would get her COVID shipment. It
Mhm.
would be nice if she could offer flu and COVID, because I know people who don't have bad reactions don't mind getting both shots on the same day.
Okay.
So we'll be in touch on that.
And Jen, on the stay well regs, you need to vote if you do want to enact them, because then you have to have a public hearing.
Oh.
Yep.
Did not realize we were voting on that today.
Yeah.
Are you all prepared to vote on if we want to enact them?
Can we review what we're voting on?
Yeah, I'm not sure we are. Is
No.
it something, Nancy, that can wait till next meeting?
Yeah.
Okay.
I think if that's okay, Nancy, we'll probably hold off on that one.
Okay. And the proposed bylaw changes, there is nothing.
And then just for next meeting, probably just a reminder of a reminder email of what exactly are we looking to sort of move forward on.
Okay.
You know,
It's the regs that you had at the last meeting. I'll put it on for the next meeting.
I don't think I was at the last meeting. That's probably
That's
why.
right.
That's
not.
probably why I'm like, wait a minute. And you've been so busy with all your minutes and things sending us.
All right.
We'll carry that one forward to the next meeting. Let's see, speaking of motions and things, we do have a few sets of meeting minutes to go through and approve. So the first thing is the September 11th, 2023 meeting minutes.
You have to table those for the next meeting.
Oh, tabling those, okay.
All,
What about-
all three?
No, just September 11.
Okay,
Oh, that's right, because I wasn't here, so I can't vote, so you don't have a quorum. That's what it is.
Right.
Got it. Thank you, Nancy. All right, so there are two others, and I think we actually have to wait for those as well, because I don't think Bill and I were members of the board back then. They're from 2021.
great.
Okay, so sorry, Nancy, they're gonna sit there as well.
Okay.
Let's see. Any old or new business? As far as correspondence, Nancy, that thing that you sent just today, should we go through that briefly? I haven't had a chance to read all 98 pages of that.
What was that, Jen?
Give me 1 second if I can just have it open. The green site services.
Keep going, refresh my memory.
It's the spill.
Oh, that's when the truck,
Yes.
yes, at the Fairview Cemetery.
Yep.
It's an FYI for you, and I sent it to Evan and William and a couple other people.
Will that be posted somewhere?
No.
Okay.
Unless you want it posted, I can.
I don't know if you all had a chance to look at that, if you have any thoughts there. Like I said, I didn't get to read all of it. It just, when you send something right before, I'm like, oh, I think I have to mention it. Okay, so we'll hold off on that. Let's see, we have upcoming meetings. We are booked out through April. Upcoming meetings are November 6th, which would be a hybrid. December 4th, a hybrid. January 8th, remote. February 5th, hybrid. March 4th, hybrid. And April 8th, remote. Are there any other items from the board members? Or
Nope.
Nancy? Or Nancy? That I missed?
No, I don't think so. No.
All right, great. Well, then I'll entertain a motion to adjourn our meeting.
Yep, this is Dan. I'd like to make a motion to adjourn this meeting. Get to Monday Night Football.
Second,
This is Austin Magnet. I will second the motion to adjourn the meeting.
roll call.
Dan Finn, aye?
Austin Magnet, aye.
Bill Muller, aye.
Jen Maynard, aye. All right. Thanks, everyone. Happy Monday. Have a good night.
Yeah.